My name's Lorianne Danielson. I'm the Chief Operating Officer at Stanton Territorial Hospital. I've been a nurse for 37 years, and I'm committed to patient safety. Every year, Canadians come together for Canadian Patient Safety Week, a national campaign focused on making healthcare safer for everyone. Whether it's in a hospital, at a clinic, or even at home, patient safety matters. And during this week, we take time to talk about it, learn from each other, and work toward better, safer care. The goals of the Canadian Patient Safety Week are to raise awareness about patient safety, encourage open communication between patients, families, and healthcare providers, and lastly, to make sure that everyone, no matter who they are, feels safe and heard when receiving care. The NTHSSA Client Identification Policy states NTHSSA staff shall use at least two person-specific identifiers to confirm that clients receive the service or procedure intended for them at every interface, including telephone consultations and virtual appointments, and before the issuing of confidential documents such as requisitions or medical records.
How can I help you?
I need to see a doctor.
Okay, are you able to provide me with your full name, your date of birth, and your healthcare number?
Jane Smith, December 25th, 1990. Here's my health card.
Thank you, Jane.
The Government of Canada notes that medication incidents are a leading cause of patient injury. Accreditation Canada notes discrepancies with medications can result in medication errors that are harmful to the client, including unplanned clinical encounters and related costs to the healthcare system. NTHSSA is committed to medication reconciliation as an important patient safety initiative, with the goal of reducing adverse drug events by ensuring accurate and complete medication information at transitions of care.
Can you tell me about the medication you're taking? Do you have any medication here with you?
I didn't bring it with me, no.
Okay, do you recall what medication you're on?
Not the names, but it's a water pill and
something for your sugar.
yeah.
We can work on finding more about that with the pharmacy and our health record. Do you take anything over the counter or something from the drugstore?
I take Tylenol and vitamin C regularly.
Okay. Any supplements or traditional medicine?
This process includes partnering with the patient and others, such as a community pharmacy, to generate a best possible medication history, including vitamins, supplements, homeopathic and recreational substances, to be reviewed with current medications to identify any discrepancies. Accreditation Canada notes that when performed correctly and consistently, hand hygiene can significantly reduce the risk of transmission of infections and enhance client and workforce safety. The NTHSSA's policy on hand hygiene notes that effective hand hygiene is the most important practice in preventing the transmission of microorganisms in healthcare. With the goal of reducing healthcare-associated infections by improving the hand hygiene practices of all healthcare workers, the NTHSSA policy defines 4 key moments of hand hygiene. Before contact with the patient or patient's environment, before a clean or sterile procedure, after exposure or risk of exposure to blood or body fluids, after contact with the patient or patient's environment, including removing gloves, leaving a patient's room, and after handling patient care equipment. The NTHSSA policy on falls prevention recognizes that those with additional risk factors associated with acute or chronic conditions may increase their likelihood of a fall with or without injury. The NTHSSA falls prevention policy also notes that falls prevention strategies will be implemented across the continuum of health services.
Okay, so do you need to go to the washroom?
No.
Do you have any pain or discomfort?
No.
Is there anything you need before I go?
Can you just move my table a little closer to me?
Sure, yes. I'm just gonna lower your bed to the lowest setting. And you have your call bell here. Just press this button if you need anything else, okay?
Okay, thank you.
Accreditation Canada's required organizational practice and NTHSSA's policies and procedures note that effective communication is the accurate and timely exchange of information that minimizes misunderstanding. Clients and families need information to prepare for and improve care transitions, including written information or instructions, action plans, goals, signs or symptoms of declining health status, and contact information for the team.
So the physician's actually written a discharge order. That means you're free to go. I'm glad you're feeling better. In this envelope is a copy of your discharge summary. Please note the physicians increase your blood sugar medication. The pharmacy has your updated prescription, so it should be ready to go when you are. You also have a physiotherapy appointment tomorrow at 2 p.m. Here's your appointment card.
Thank you.
Canadian Patient Safety Week is a reminder that safety isn't a single action, it's a shared commitment. Whether it's confirming client identification, reconciling medications, practicing proper hand hygiene, preventing falls, or ensuring clear and accurate transfer of healthcare information, every step matters. Together, these actions protect patients, reduce risk, support families, and empower healthcare teams across the NTHSSA.